Hi, I'm Dr. Jeff Borenstein. I'm the editor of Psychiatric News, and I'm here with Dr. Saul Levin, the CEO and medical director of M.P.A. Saul, thank you for joining us. This has been a very active year. As we begin the annual meeting, I want to start off by looking back at the accomplishments, of which there are many, but at least highlight the key accomplishments over the last year.
Well, thank you for the invitation, and yes, it has been a very exciting year and a very busy year for both the M.P.A. and the board and the assembly and for our members in this year. So I think the big one is, from an organizational perspective, is the strategic initiatives that the board spent a year looking at as to what are the big issues that M.P.A. needs to focus on in this new affordable care environment for our members. And what came out was 4 big areas that will be very member-focused, helping no matter what area you practice in, we will be able to help you with some of the tools and ways that you can enhance your practice in this changing environment. So I think that's the first big one that we have to look at.
That change is coming, and M.P.A. will assist our members and our profession with that change to help patients.
Exactly. And it doesn't matter what area you practice in, because in the Affordable Care Act, there will still be all those areas to practice in, except some are going to be more given highlights by the Affordable Care Act about the new practice that they're asking United States to do. So collaborative care will still be one of the big issues that we will look at and help our members as to what are our roles in collaborative care. Where are we in the bundle payment systems? But if you're in solo practice, you'll still be able to do your solo practice. We will begin to try and help you getting an electronic health record to try and begin to link into the system. For instance, in New York, they now have to do e-prescribing. They can no longer give a written prescription. We're going to look to how do we help our members do that, so it becomes very focused for them. And obviously, the next part of it is education. Clearly, we do have maintenance of certification. How do we make it the easiest possible way for our members to get certified, or those that are going through the certification process? And we're going to do it where we're going to look to give you monthly questions that will automatically qualify you in terms of the 4 parts of MOC. And you'll find that we will give you user-friendly ways to do it according to the way you would like to get those.
User-friendly that meets the criteria and also sort of meets the needs of our members.
Correct. And the whole idea of maintenance of certification, and we know that our board took a decision to ask ABPN, our board, and also ABMS, the Medical Specialties Board, to really look at that Part 4 is not working. And the idea is we don't want to check off boxes. What we do want to do is, when you're going through Part 4, that it's relevant to your practice, what you do every day. That's what lifelong learning is about. It's that not to know everything, but to make sure that you're totally up to date in what the practice you're doing. And I believe every physician, every psychiatrist really believes in giving the best patient care, and that's with their knowledge that they can go on. And we're going to help them get there.
One of the initiatives that I know began over this past year and will continue through next year has to do with how we present ourselves to our profession, to colleagues, and to the general public. And I want you to speak about that.
Good. So thank you. You know, after many years, the board decided that we were going to go through a rebranding process. And in some ways bring the M.P.A. where the public begin to be able to differentiate us from some of our other mental health professionals. Very often, sometimes we see it that they'll confuse psychiatrists with psychologists, and people don't know. Some of the legislators told us, some of the public said to us, that they don't quite know what the difference is between a psychiatrist and a psychologist. But when we say to them, we're the physician psychiatrists, they're then very clear. So
they understand
what that means. They understand that we're physicians having gone to medical school. We then went to another 4 years of training, and if you subspecialized even more. And they then realize that we come with not just the psychiatry part of us, but also some of their primary care problems that they may be discussing with their physician. And this gets integrated when they come to also see us. So the wonderful thing is, at this meeting, we're going to be unveiling the new M.P.A. logo as well as the tagline, which will further explain what is psychiatry today. And I think we're going to once again have it very clear to the public. We are the American Psychiatric Association, and that we are the physician psychiatrists. So look forward to it, and we're hoping that both our district branches, our state associations, will also become part of that branding. We're not going to lose Benjamin Rush, our founding father, who is also a psychiatrist, signed the Constitution, that he will still be our seal of the American Psychiatric Association, used on our medallions and our convocation when we honor the great psychiatrists that are now in this country. So I think it's going to be a really wonderful unveiling to the public as to what is psychiatry all about.
Well, that's exciting, and I think that it really symbolizes the work that the entire leadership have done, but really the work that you've done in your role to help bring us forward as a profession in order to benefit patients. So I want to thank you very much for everything you're doing, and thank you for joining us here today.
And thank you for all the work you do, and thank you for working with not just me, but my team in the staff and the administration, and also with the APA. You do a great service to the psychiatrists in this country. I appreciate it.
Thank you so much.
Okay.
Good.